A joint replacement is really where a worn out hip or knee or shoulder or joint gets resurfaced with an implant. Really, you don't consider a joint replacement until you've made an appropriate diagnosis and exhausted conservative treatment. With a hip replacement, you're actually removing the ball and putting a new ball and a socket in, so we're truly replacing that joint. With a knee replacement, they named it knee replacement, but they really should have named it knee resurfacing, because that's what a knee replacement is. We're making engineered cuts on the thigh bone and the shin bone and the kneecap, and we're resurfacing the ends of those bones with metal and plastic. There is no such thing as too young. However, there are concerns with, could my joint replacement wear out in my lifetime? The technologies that we have now are fantastic. In fact, if you look at a joint replacement, 20 years later, 95 out of 100 patients are still doing fine at 20 years. However, if you're a really young patient, you've got more miles to put on those tires and there is some potential to wear them out. The treatment of hip and knee replacement has really evolved over the past 40 years. We've learned that early mobilization is actually much better for the patient to prevent some of the potential risks, such as a blood clot, and we actually get the patients up and moving and walking the day of surgery. I'd say the average length of stay has continued to decrease, and most of my patients are in the hospital between 1 and 2 nights. A hip, I tell patients by a month they're doing very well and are about 85 to 90% recovered. A knee, it takes 2 months for them to be 90% recovered. If you're motivated and have a sedentary or desk type job, with a hip you can be back to work in 4 weeks, and with a knee you can be back to work in 6 weeks. However, if you've got a more involved labor type job, it may be closer to 8 weeks. A common misperception is that maybe if I get a joint replacement, I have the knee or the hip that I had when I was 20 years old. That's not realistic. However, they are fantastic operations to really improve quality of life. Every day when I talk to patients, I tell them the single most important variable is patient motivation. And they've got to mentally prepare themselves to work hard so that we get a good result. Really, you don't consider a joint replacement until you've made an appropriate diagnosis and exhausted conservative treatment. So it's really got to be somebody who's got a badly worn out joint that's failed conservative treatment and is ready to get out of pain, restore function, restore mobility, and improve quality of life.